Hi, it's Diederik Elderman here again. And remember, we're talking about marketing this week. And last week we talked about the welcome system to increase your client retention from the average of 40-45% up to 80-85%. Well, so that was the welcome system for retaining your clients. We're now going to talk about bonding your client and keeping them forever. I could actually talk literally on this all day. Absolutely all day, quite easily. Last week's video was a little bit long, 20 minutes or so. I'm going to try and keep this one down and just give you some really pertinent, relevant, short, crisp things that you can do really quickly that's going to increase your client bonding rate immensely. And the first one is the courtesy call. So there's two kinds of courtesy calls. In my model of the world anyway, there's two kinds. The first one is the call when the pet's in recovery. So this needs to be on a whiteboard. So on your whiteboard, your surgery whiteboard, you'll have pre-med given, PAS done, IV fluids attached, pain meds given, whatever it happens to be. Just add another column there and that column should say courtesy call. So when the pet's in recovery, you know, your nurse Jody is going to do one of a couple of things. The simplest thing is, hey, Mr. Smith, it's Jody here from the vets. Just letting you know that Amy is in recovery, surgery went well. Just relax and get on with your day, and we'll see you at 4 o'clock when you're scheduled to pick her up. That's really quick and easy. And if you were a mother or a father and your child was in surgery or in hospital, wouldn't that sort of call really relieve your anxiety? Well, pets these days are part of the extended family, and when you start doing this, the feedback and the oh my golly, thank you so much type that you're going to get are going to give you goosebumps. How delighted these clients are that you've actually thought about extending that sort of courtesy to them. An extended way to do that, and plenty of my coaching clients do this, and they'll do it when they have time. So the courtesy call always happens, but they'll add a little bit of an extra spark if they've got the time, and that may be the nurse actually sitting in the kennel with the pet, and another nurse will do the video. They may do that selfie thing, and they'll have, you know, Amy or whatever I call the puppy a couple of minutes ago waving her paw or saying hi mum or whatever it happens to be. So that adding the pet into that scenario, and that will be a video plus a little bit of relax, get on with your day, and that obviously can be sent as an SMS quite easily to the client. So that's one kind of courtesy call. The other kind of courtesy call in my world is the call that occurs, say, 2 days after a visit. So every patient in our practice at Green Hills, every single patient or every single owner was rung 2 days after the pet's visit. So 2 days after the surgery, 2 days after the medical exam, whatever it happened to be. And you've got to script these phone calls really carefully, because it'd be terrible to have a nurse ring up saying, hey, it's Jody here from the vets. Dr. G just asked me to ring. Was everything all right with Fluffy after the vaccination? Because the client's going to say, oh, what was wrong with the vaccine? So you want to script it. So obviously with ear problems and skin problems, it's surgery cases, it's quite easy. Hey, you're getting the meds in. Is Fluffy walking on the leg? Is the ear looking better? Were there any questions you forgot to ask? So that's fairly easily scripted. And yes, it should be scripted so that the nurses all do roughly the same thing. With a vaccination exam, the scripting may be a little bit harder. The way I like it is, hey, it's Amy here from the vets. Dr. G asked me to ring you to see whether there are any questions that you forgot to ask while you two were together the other day. You know, he did a comprehensive physical exam. There's a number of things came up. Was there anything you forgot to ask, or was there anything he didn't explain as well as he could have? So that the phone calls in both those scenarios always appear to originate from the vet, so that the vet is the hero, as it were, so that the vet looks you know, very good in your client's eyes. Now, don't get hung up about, when I talk to clients about courtesy calls, or when I talk about courtesy calls in seminars, so many vets say, oh, we don't have the time, oh my God, not another thing, we can't do that. Well, yes, you can. You can start thinking laterally. These calls do not need to originate from within your practice. I'll give you an example. Richard in Western Australia, one of his daughters is off in Perth doing uni. And so she dials into his system every day through TeamViewer and then rings the people that are due to be rung today. Now, she is an 18-year-old uni student. She's never worked in the practice. She doesn't have medical knowledge, but she's great on the phone and she's a really nice person. And if there's a question she can't answer, she says, let me ring up Dr. Richard and I'll get him to ring you straight back, or whichever one of the vets was responsible for the case. So you can outsource these calls to someone that's on maternity leave, a nurse that you may not have hours for in the practice, but is happy to work from home for a couple of extra hours. A client, we started off at Green Hills, we outsourced them to a lady that was a client. She'd had a number of kids and she was at home because she just recently had twins and another boy just before that. So she couldn't actually go into work anywhere. She'd never worked for us. She was just a client with 2 boxes, but she was an intelligent woman and she was really empathetic. So she came in, picked up, we used cards back in those days, did the cards, made the phone calls, put the cards back on the table in the morning, and if there were any challenges, one of the vets or one of the nurses would ring that client up. So you don't get hung up on the fact that it's got to come from inside the practice. You can outsource it. So that's the second thing. The third thing that you need to do to bond a client is to keep in touch, whether that's a newsletter that you do monthly or bi-monthly, whether that's a blog that you do monthly or bi-monthly, so you can have a newsletter 1 month, a blog the next month, the newsletter the other month, the blog the next month. Very easy to do. Facebook posts, and the thing I'm going to say about Facebook is either do it and do it well, or don't do it at all. Doing it and doing it well means that you need to post on a regular basis. If you want to post just once a week, that's fine. If you want to post twice a week, that's fine. If you want to post 3 times a week, that's fine. But be consistent when you do that. Some of the practices that I'm working with, they say that their Facebook is working really, 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 really well. They're posting 3 and 4 times a day. And I'm not saying you need to do that, but whatever it is that you do, do it properly. Don't post 5 times this week and once next week. The clients are going to feel let down. And don't just post, cat videos and dog pictures and pretty puppies, because all the client thinks that you're good for then is cat videos and dog videos and pretty puppies. You need to really get some meat into your Facebook posts, some real substance, that's the word I was after, some substance into those Facebook posts. Yeah, you can have the odd cute puppy picture, but you want to tell them about things that have happened to clients, things that have happened to staff, good things I mean, share that sort of commonality, talk about new things, talk about patient outcomes, follow cases through for 4 or 5 or 6 weeks. If you haven't looked at Richard Lucas's Facebook post, he did a Maggie story. It may be so far down the newsfeed now you won't find it. But if you go to Busselton Veterinary Hospital, try and find Maggie's story. He had over 1,000 views in 3 days from Maggie's story. And that was a mixture of Facebook and Facebook Live. And that was the next thing I'm going to talk to you about. Facebook Live is an awesome tool. There's a gentleman, a cow vet, and what he mainly does is repros and postmortems, right? His name is Creel. He's up in Canada, Vancouver, Canada. I've forgotten his last name. He has over 1 million views on his YouTube site, and he has 1,800 YouTube subscribers. He's 31 years of age and he's built this up in 15 months. Go figure. He does a mixture of YouTube, Facebook Live and Facebook. And he says that this brings him in between 3 and 4 new clients a week. Now, they're in a very small demographic area. They're cattle people. You know, it's not as if there's 3 to 4 new dairies or 4 new beef herds moving into his locale every week. I mean, it's a maxed out area. There's other vets, but because he's so active on Facebook Live and YouTube, and he's showing postmortems, maybe not all the gory bits, but he's showing postmortems and what he can do, and he's telling them what he's doing when he's doing a repro exam or stitching up a slashed teat or treating a foot abscess. And those beef farmers and those dairy farmers love it. And like I said, his practice is growing exponentially. So if a cow vet can do it, then certainly a small animal practice, there's enough collateral coming in their door every day to share interesting stuff with the clients. And then the last thing I was going to talk about for bonding the client, like I said, I'll go on for 2 days, but I just picked a number of things that I think are going to give you the biggest bang for your buck immediately. And that last thing is patient report cards. Patient report cards do a number of things. Number one, that report card that they walk out with is an incredible value building tool. It's an incredible concrete representation of the value that they've gotten in the consultation. Number two, studies show that 47% of the clients that leave your practice, 47%. So let's say half, okay? Half the clients that walk out of your practice have unanswered questions, have challenges, or are confused. So when you give them a report card and things are written down on it, then that number drops hugely. Now, you don't need to fill out a report card like a Tolstoy novel. You make some brief notes, and that's it. And you tell them, here's some memory joggers. If when you get home, any of this is not 100% clear, ring up and talk to me, or talk to Laura the nurse, or whatever it happens to be. Those report cards should be very visual. You'll find plenty of examples on the net. They should be very visual, picture driven. Separate one for a cat and a dog would be my suggestions. And they should take no more than 60 seconds to fill in. And then you give them the client and on there you've written in red, this needs to be done by the 12th of August, teeth cleaning, for example. So perception of value is one thing that I said. And the second thing that they do hugely is increase future uptake of services, if that makes sense. So when you talk to them about teeth and lumps and x-raying elbows for arthritis or whatever it happens to be that you're talking about, you'll find that when you use report cards that there's many more clients going to come back to have those procedures done because they're there on the fridge, they're looking at them every day, they're still high to mind, and they'll remember. So that's it for today. I'll catch up with you again next week. Enjoy and get cracking.